welcome to 72 Dragons Health. Today we had the pleasure of speaking with Amanda Rostic. Amanda Rostic is a dedicated public health professional and filmmaker, passionate about improving healthcare equity. With a background in science, technology, engineering, and mathematics, and a focus on epidemiology. She works tirelessly to ensure fair treatment, particularly for Black, Latinx, and Indigenous communities. Her roles in various health-focused organizations like Corewell Health reflect her commitment to strategic advocacy, community empowerment, and mentoring. Her involvement in initiatives addressing maternal and infant health disparities shed light on systemic issues, aiming to drive positive change in healthcare. Amanda's work spans from mentoring young leaders to advocating for policy changes. Welcome to this interview, Amanda Rostic. It is an honor and a pleasure to have you with us today. My name is Dr. Pietro Aparicio from 72 Dragons Health. Without any further ado, let's begin. What inspired you to go into a master's in public health and to focus on health equity and advocacy?
Yes, I love this question. So for me, I originally started my career working in the emergency department in an outpatient care setting as a tech and a registration specialist. And in these two roles, I would see patients and they would come into the emergency department, or I'd see them on the outpatient side, and it keeping in for the most random things, the types of things that you wouldn't expect to see someone in the emergency department for. Kids coming in with ear infections, or people coming in with really big problems that if they had a primary care doctor, they would have managed care and we wouldn't be seeing them in these types of settings. So what became apparent to me was this pattern. There were inequities and disparities in the types of patients we were seeing from a demographic standpoint and the reasons they were being seen. But I wasn't quite sure of the disconnect. What started to really resonate with me was patient stories. So people would tell me things like, well, I couldn't go to the doctor because I didn't have childcare. I didn't have reliable transportation. I'm an hourly worker. I can't take work off to go be seen. And I think the most disheartening thing that I've heard in my time was I was afraid to come in because I didn't want that bill. People are afraid to be seen because they couldn't afford care. So then I realized, well, there's a problem with how we're communicating what care means outside of our four walls. So as much as I enjoyed the bedside, patient-to-patient kind of clinic setting, I thought maybe my time and energy might be better spent figuring out how to bridge the gap on the administrative side and helping entire groups of patients instead of just one by one. So I traded my hopes to go to PA school for graduate school, and I haven't looked back.
Wonderful. So that's a significant change in your approach, which is a very inspiring, actually. Could you elaborate on the projects you are leading at Corewell Health as the Senior Operations Project Manager and Strategist, especially regarding your focus on diversity, equity, and inclusion?
So I was very excited to make the transition from the health equity team to the diversity, equity, inclusion team. I was a little nervous, a little intimidated, but I've truly fallen in love with this work. Some of the things that I'm really proud of at Corewell Health. So 3 things stand out to me. One of them is honoring and acknowledging cultural observances. So Corewell Health is the largest employer in the state of Michigan. We have over 70,000 employees. So as you can imagine, a pretty diverse workforce across the state. What we like to focus on is everything that matters. Not always easy to do in a calendar year, but we're making a really good attempt at doing so. So we celebrate and uplift things like Juneteenth, Hispanic Heritage Month, Lunar New Year. There's some new ones that will be rolling out too. So this really is a way to make our employees feel seen and heard and included. But I think it means a lot to patients as well when you come to one of our healthcare centers and you see that we're celebrating these observances. Another thing that I'm excited to be working on and that we do is we participate with community, right? We have these community sponsorships, but it's so much more than money. we have our employees really out in the field, allowing community to lead the work, but we either provide dollars to help bring these dreams to reality, or staff or support. So uplifting the work that's already being done. We partner with national organizations like the YMCA, but we also partner with more grassroots organizations like one you may not be familiar with is the Detroit Storytellers. So it doesn't really matter what size you are. I like that our healthcare organization is partnering with groups outside of healthcare. And then last but not least, something that is really important to us is making sure that our staff and our team members inside the hospital reflect the communities that we serve, right? It means a lot when you go into a doctor's office or an emergency care setting that the people who are helping you look like you. That's a way that we can foster a sense of community and belonging within the community. And one way that we're going about doing that is making sure that we're intentional about sourcing diverse talent. So those are just a few of the things I'm excited about.
Yeah, a very important point that the community identifies also with the healthcare providers that speak like them and speak and look like them. Now, could you share insights from the Delivering While Black screening at the American Public Health Association's annual meeting in Atlanta, Georgia?
Yeah, so this was my first screening and I learned so very much. I have to be honest, the reason the film was created and even exists was for the MPH conference. So the fact that we were selected, it just meant everything in the world to me. But some of the things that I learned, I was really nervous putting a documentary out to the world about the Black maternal health crisis, right? I was worried that it would seem dense, and I was worried that people would find the content depressing, and I actually found quite the opposite. Like, there is an appetite for this information, and then using a documentary as a vessel to deliver it, it's really impactful. And I'm sure we'll kind of dive into my thoughts around it, why I think the creative arts and the sciences should really connect. But what I learned is that people do want this information, and delivering it in this sort of cinematic way is a great way to go about it. My ultimate goal would be to use this as an educational tool, but what I'm finding is this is going to be great for not only individuals that work in healthcare, so doctors, nurses, doulas, but also your everyday citizens, right? We all know people who may be in a situation where they're having a baby or entering the healthcare system. So some of my big takeaways were that people want this information, even if it seems like it's a lot. It's information that people are seeking.
Great. I was curious about the name. It's a very catchy name, Delivering While Black. How do you come out with this name?
Yeah, so the name, it's funny. I can't remember if the name came first or the idea of making a documentary came first. But with the title Delivering While Black, it really is a nod to, if you're familiar with the concept of driving while Black, it's something where Black motorists are in fear because of what they look like, how they may be treated. So it wasn't hard to tie this to this theme that we're seeing. There's a global theme for delivering as a person of color, but especially in the US where we see these stark disparities. And I'm like, it hit me one day, because when I was younger, I didn't understand what driving while Black meant. I heard my parents say it when I was little, but to work in healthcare and think, wow, it's scary being a Black woman and entering the healthcare system and having a baby. And I'm like, there's a tie to delivering while Black, very similar to the way a Black motorist may feel. Will I be treated different because of how I look and who I am? And then the name just came to me. I'm like, right on that same way, delivering while Black, driving while Black. These are things that we as people of color carry with us and think of when we enter the healthcare system.
Thank you for sharing. Actually, when we were doing the research, that's what kept popping up, driving while Black. After the experience at the American Public Health Association screening, how's that impacted your perspective on advocating for public health?
Oh goodness, the thing that stands out to me most is this has given me a new tool in my arsenal for advocacy, right? Advocacy can be so cut and dry. A room full of people come up with an idea, they write it down, we cascade the information out. It's almost two-dimensional. It's written and then it's expressed. But what I learned from APHA is if we can put narrative in this, it's that much more impactful, not only for policymakers, but it allows patients and healthcare providers to really tell the story and paint the picture. I think this reinforces policy. And I think it'll be a good way in the era of TikTok and social media to get information out there. I don't think anyone is anti-policy. I think the way policy is presented can be a little dry for the everyday stakeholder. And by using things like narrative, we resonate with people, right? We bring back the importance, we bring the emotion into this equation. But I think what's most important is we have this real opportunity to use things that are creative and more on the artistic side with science to bridge that gap with policy. So I am very excited to see how creative I can be with my background to really help push policy forward in a way that's approachable and receivable to everybody. And Dr. A, I think the most exciting thing about this avenue is it brings the humanity back. How can we center humanity again in healthcare and policy? That is my big dream, big goal. And I think film is a way to do that.
Thank you. Yeah, that's a good segue for the next question. How do you envision the long-term impact of awareness in building initiatives, like delivering While Black in reshaping healthcare practices and policies that you mentioned a bit about that? Are there other film production projects that you are looking into in the future?
Yes. So something that I think helps. So policymakers have a job, right? Their goal is to take the data and take the information that they're given, get the information out there to see what changes we can make and make it law or make it rule to follow. I think the big role that film and other forms of media can play in this is this reminder that every piece of data, every number, every statistic, let's roll back and realize this is a person. This is a family member. This is a real human being. I think that is the power in awareness. I used to find myself frustrated thinking people didn't care about these topics that healthcare practitioners care about. And I don't think it's that. I think there was a lack of awareness and a lack of information in a way that they could process. If you have a technical guide and you put it out there, it's 100 pages, the average person doesn't have time to read that. I work in healthcare. I probably don't have time to read all of that. So really, sound bites, these media clips, but bringing home that the humanity, this is a person, right? Black women are 2 to 6 times more likely to die in childbirth. That is a dark and scary statistic. But when you have, someone that looks like me that can be in front of a camera, even if it's on a TikTok, and say, hey, this number is me, I am in this number, I think that's the power of awareness. And yes, Dr. A, I do have a next project that I'm working on. There will certainly be a part 2 for delivering While Black. But something else is just with this epidemic of obesity in childhood, there's a sports company, All Good Sports. They're a nonprofit. I'm excited to work with them next. They have a lot to do with keeping children active, keeping them engaged in a physical way, which I know APHA is all about, but they also want to protect children from gun violence. So kind of twofold there. I think in public health, there is no shortage of material for me to work with, and I will be making films for a very long time.
Great. We're looking forward to you next film production. Amanda, thank you for your dedication to improving healthcare equity and for your commitment to marginalized communities. Your work is truly inspiring. Thank you.
Thank you so much. I really appreciate the opportunity to be here today.